Hey all, welcome to ShareTreck. This is Raj here, your host. Just when you think everything is going well with a genomic company, they go and make a mess of it all. Today, I'm talking about Allogene. I was praising Allogene just the other day in my last video. I think around the same time that I released the video on ALLO 51A and the companion ALLO 647, and I was praising that this was a genius idea and it would do great and all that. They had a press release and they said that they had made some strategic changes, and those changes made the share price of Allogene drop like a rock. So today I'm going to talk about what they did and why it is bearish, and you will be shocked when you hear this. And those of you who are from the same field and who understand how these trials work and what Allogene was doing, please, I'm looking forward to your feedback in the comment section so that we can all be educated. So please let me know what you think. I'll explain in detail the way I understand why this is for bearish for Allogene. Let's get started. Welcome back, friends. I believe we need to understand the company and its products before investing in it. Unfortunately, genomic companies are not run-of-the-mill daily use products, so one needs to dig a bit deeper to understand the company and its valuation prospects. Big firms and high net worth individuals have analysts doing this job, while we retail investors have to dig up the information for ourselves and use our own logic. So there's going to be a vast difference between what a high net worth individual or a big institution has for information, because they would have PhDs doing this kind of a research, and they would have paid data sources, and they would have contacts with the company to get inside information on all permissible information that the company can release while being compliant with SEC. So they have a heads up or edge over us, whereas we retail investors have to pool our knowledge together. So I would call on our viewers who are familiar with the industry to comment on this video so that we can share your experience as well. The announcement made by Allogene yesterday initially sent the stock price down by almost 29 to 30%. So you'll see, if you look at the price chart, there was a wick that went almost down to 30% and then bounced back quickly. It ended the day on Friday 16.5% down, and that's a huge drop for any company. Let us understand the reason for the strong reaction from the markets. Let me first explain what has to be ditched or reprioritized by Allogene according to their new strategic change. So, in the context of FDA approval for a new drug or medical treatment, a pivotal trial refers to a crucial and often large-scale clinical trial that is designed to provide substantial evidence regarding the safety and efficacy of the intervention. Pivotal trial plays a central role in the regulatory review process and are a key component in the submission of NDA or new drug application, or BLA or biologics license application, to the FDA. Allogene initiated the first pivotal trial for ALLO 51A in October 2022. This means they invested in the study with the potential to get registration and enter the completion before the likes of CRISPR Therapeutics and others could further crowd the field. So, as I explained to you yesterday, right now we have only autologous CD19 therapies out there, and FDA has got big concerns on autologous CD19 and BCMA targeting CAR-T therapies. So Allogene, I thought, had a great advantage, and especially with ALLO 647, I think it was a winning combination. I just wanted them to keep on going as fast as they could, get the approval, get into the market, and done. Right? At this, that didn't happen. At the same time, Allogene raised more than $500 million when they started this study through private financing and also through initial public offering. Their company has had a few setbacks so far, even though its cell therapies, particularly ALLO 501A, have shown promise. And the name Allogene itself, they had me by the name Allogene. And I was looking forward to this company. There have been questions about their durability and effectiveness for their therapies, the CAR-T therapies that they have been working on, and the field has gotten more competitive while they were still trying to develop the allogenic CAR-T. And with an emerging group of companies advancing therapies using different types of cells and CAR-T moving into earlier lines of care, I think we are seeing CAR-T therapies coming into the forefront. because when they move into earlier lines of care, that means a doctor would potentially prescribe a CAR T therapy as a first line of treatment. That's where the allogenic, that's where the autologous CAR T were trying to move to before FDA had those concerns. And allogenic CAR T don't have that problem, so they should be able to be first line of care. Most companies try to aim for their therapy to be first line of care instead of being the last resort when everything is hopeless. So in the last quarter of 2022, Allogene's research was delayed by the unexpected finding of a chromosomal abnormality in a treated patient, and the FDA froze Allogene's program for months during that time for investigation. Around the same time, one of its partners, Servier, cut its ties with the company. And when therapies move to earlier line of care, it's a good thing. Most companies strive to have their products to be first line of treatment. The new announcement makes me think that probably ALLO 501A was not as good as we thought, and the deprioritizing of the two pivotal studies, which is such a hard decision, was still taken. Imagine the money sunk into the study, right? That's the totally crass motive. Just imagine the money, how much money was wasted, right? Because they are deprioritizing it. The patients who volunteered for the study, they are human beings and they came into the study with hopes that this is going to cure, and they volunteered their life and their time, and they took the pains that would come through the risk and everything. Now they are going to be going slow. Right now, they would get the message that the company is deprioritizing those studies. Can you imagine how hard it is going to be for those patients and the relatives, right? And finally, the impact of that on the share valuation. That's those are all the negative impacts that would happen, which the management would have thought very long and hard about it, and still they went ahead and made the decision. So that makes me wonder whether it is strength of conviction or is it desperation. The expand trial was testing ALLO 501A with ALLO 647, exactly the thing that I was sold on. And let me explain to you where they are trying to aim ALLO 501A now. There is this therapy called Arop, which is the current standard of care that's being used for large B cell lymphoma. Arop consists of the following 5 components that you will see on the screen here. The first one in Arop is the initial R for rituximab, and it's a monoclonal antibody which targets CD20 on B cells, promoting that destruction by the immune system, and it's used to enhance the efficacy of chemotherapy. C stands for cyclophosphamide, and it's an alkylating agent, and it interferes with the DNA replication, preventing cancer cells from dividing and growing fast. And H stands for doxorubicin hydrochloride, and its function is to inhibit DNA and RNA synthesis, disrupting the functioning of cancer cells. O stands for oncovin, which kind of inhibits cell division by disrupting the formation of the mitotic spindle. And P, prednisone, is a known steroid. It has anti-inflammatory and immunosuppressive effects, helping control lymphoma symptoms, used in combination with other drugs. So this is a combination which is called RCHOP. There is empirical evidence that 30% of patients who have been treated with RCHOP for LBCL will relapse. ALLO now wants to test a small number of volunteers, I think around 12, on these of the patients, and position ALLO 501A on those cases. I'm still trying to come to term with why they would have decided to target this 30% which would be relapsing instead of going for the LBCL as a front line of treatment. I don't know if it's coming from a position of strength or weakness, what it is. But if they had persisted, I was optimistic that they could have been the first allogenic CD19 CAR T therapy. They would have beaten CRISPR to the punch, and they would be making really good market gains. The market promptly punished them for this action. Many investors decided to dump first and think later. And I personally am going to stay away from Allogene for a while, and I would like to see how they perform and what the fallouts will be. Friends, I think in case of startup genomic companies, I think CEO uh, uh, has got to be good. And that's why I have a great deal of admiration for CRISPR Therapeutics and Caribou Biosciences, where I see that they are controlling the balance sheet, they are doing a good job, even Editas for that matter. They are doing all the right things, like they're not wasting investors' money, they are not taking risks which are unreasonable. so that they had to change course in midstream. So in my opinion, it seems a very bearish catalyst what they have done. And I'm not a scientist and I'm not a doctor, but my bearish feeling comes from the fact that I have been reading up on so many genomic companies and their therapies, especially LBCL and all, in order to describe and understand therapies that are being created by various companies that we invest in. And it seems to me that this is bearish. If any of you out there are working in this field or you have a better understanding, and if you think that I have got something wrong, please put it in the comments, and I would like to check that out. We all like to get educated because at the end of the day, we are putting our money into the market, and we need to know what kind of a product the company is coming with and what is the chances of success, and if we have a good CEO at the helm. So that's why I want your feedback. And yeah, I think that's all for from me for now. I don't have much. Last time I did a video on Verve, and then I came back with an extra update. This is not deliberate, but this has happened by coincidence that once again I'm coming with an update, and this time it's for Allogene. So I hope you guys have a good day in the market next week. This week has been slightly better. I'll be doing my daily update video. Please have a look at it and give me your feedback. I do technical analysis on a bunch of stocks which move the market and also the genomic companies. And if you have any special requests, I could do that in the daily update section. So please check out my daily update videos. There are very few people who are watching it. So I would request more of you to have a look and give me feedback on what I can include in it so that you would be interested. With that said, bye for now. I'll catch up with you later.